The Brain Injury Guide and Resources is a tool for professionals, community members, and family to understand traumatic brain injury, as well as how to promote better living for those who live with a TBI. In this interview, we will talk with Andrea Buning, a TBI survivor and member of the Missouri Head Injury Advisory Council, to learn how TBI changed her life. And Andrea, thank you very much for being with us. We appreciate it.
Thank you for having me.
First of all, Andrea, how did you sustain your traumatic brain injury?
I was driving back to my home on a really simple two-lane road that had no shoulders, and a truck was passing on a hill, and I took the ditch on my side of the road, and he took the ditch with me and hit me head on.
And what sort of injuries did you sustain?
I have a traumatic brain injury, and I have an acetabular fracture with 17 screws. And I was in a coma for 7 weeks, and I have no memory of anything probably for about 3 months.
And your son was in the car too,
Yes,
right?
he was.
And what injuries did he sustain?
He had a massive amount of orthopedic injuries to his hip. He didn't end up with a brain injury, but he was trapped in the car for 2 hours.
And then you spent a considerable amount of time in the hospital, didn't you?
Yes, I did. I spent 4 months inpatient, and then 7.5 months in an outpatient program that was there at the hospital campus. But I started out at KU Medical Center, and I was there for 3 weeks.
And tell us about the kind of therapy you received during that time.
I had recreational therapy, I had occupational therapy, speech therapy, and physical therapy.
And you were telling me earlier, Andrea, that you were able to get access to some of this treatment that you needed because you had a strong advocate.
Yes, I did. My mother and my family members were extremely strong advocates for me. If my mother had not been an advocate for me early on when I was at the hospital in Kansas, I would have ended up in a nursing home. But my mother found Missouri Rehab Center in the phone book, and she spoke with them, and they agreed to take me, and now that the rest is history. She's been a wonderful advocate for me.
Is that something that I'm sure you highly recommend for families who are dealing with this sort of situation, that they be strong advocates?
Extremely so. And the more they learn about brain injury, the better that their survivor is going to do as far as accessing services and accessing help. And if at any possible way they can get in touch with an independent living center, then they should. I'm
sure this was a long haul. You had to be very patient, I'm sure, in your recovery.
Well, probably the first 2 years I was probably in a fog. While I was in the hospital, I definitely was in a fog because I just went along with the program. I had people say, well, you're so courageous, you're so strong, you're this, and I'm like, I just did what they told me to do. I felt like that they were the ones with the education. They knew better than I did. And if they told me to do something, I didn't argue about doing it necessarily. Not all the time, anyway.
Yeah. Were you encouraged by the progress that you were making? Could you sense that you were making progress?
I had no clue about what I was doing or why I was doing it. I knew that I was in a wheelchair. I knew that I couldn't walk. I knew that I couldn't remember things, and I also knew that I couldn't leave. But I really did not have any awareness of what was going on around me as far as other people's thoughts and if I was making progress or not. I really did not know.
Well, today you're obviously functioning very well. Can you tell us about how the traumatic brain injury has affected your life?
Well, okay, I've had 3 neuropsychological evaluations, and the first one was done very soon after my injury, and it did not come out well at all. My second one was done while I was going through voc rehab when I was still at the hospital, but the last one was done 1.5 years ago, and it was requested by the disability support services at the university that I was involved in. And at that time, the neuropsychologist told me something that gave me a lot of hope and gave me a lot of encouragement. He told me that IQ has nothing to do with functional outcome, and he would not even tell me what my results were from the testing until he had told me that I'm functioning far above what they expected me to function. So that really made me feel good.
Mm-hmm. What sorts of things are easy for you now or difficult for you to do?
Organization is a constant thing that I have to work on all the time. I live by a schedule. My life is by a schedule. I have to know where I'm going exactly, and I have to know how long it's going to take me to get there. I have to use a GPS that speaks to me rather than reading a map, because I obviously can't do that. And multitasking is difficult, as it is for most people with brain injuries. Speaking can sometimes be difficult. If I get nervous, or if I get stressed in any way, I'll start stuttering and I won't remember words, or I'll say red when I mean blue, or they call that word finding problems, and I get really exhausted easily. And if I get too much going on at once, I have a tendency to overload, and it's kind of like, you know, how circuitry, you know, in a home will overload and flips the breakers. Well, that's me.
And your work on the Missouri Head Injury Advisory Council, Andrea, tell us about that. Why do you think that's important?
People with brain injuries need an advocate. Throughout the state, they need an advocate. They need their families, for one, because families usually are able to make decisions for them that they can't make for themselves. An advocate at the state level is very important, because people with brain injuries don't have enough services available to them, and many times the normal population does not understand what a person with a brain injury needs and what a person with a brain injury wants, and they have a hard time communicating those things. And an advocate at the state level is extremely important, because we can make more of a difference there than we can one-on-one.
What advice would you have for others facing TBI and their family members?
Learn everything you can about what's available. Learn everything you can about brain injury in general. The one thing I did for myself was, when I got out of the hospital and I was at home, I spent a lot of time on the internet just reading information about brain injuries. I learned a lot about myself that way.
All right, Andrea, thank you so much for sharing your story with us today. Thank you for watching this interview on how a TBI affects a life, a service of the Brain Injury Guide and Resources.